It gives me great pleasure to ask to come to the podium Dr. Ian Alexander, the Head of Gene Therapy Research at Children's Hospital at Westmead, and his presentation is looking at cancer gene therapy. Ladies and gentlemen, Dr. Ian Alexander.
So I'd like to begin by just thanking the organisers for the opportunity to speak here. A special thanks to the Honourable Jillian Skinner and then also to my CEO, Elizabeth Koff. So I'm a paediatrician and a researcher, and I work in a very special place, the Children's Hospital at Westmead. Not perfect, but very special. So why is it such a special place? Well, it's related to the nature of our mission. It's related to the special and privileged role we play in society. And it's also special because there's things that we can make happen there that we simply can't make happen in other contexts. So obviously we're heavily involved in trying to provide excellence in clinical care. We're involved in teaching the next generation of doctors and nurses, and we're involved in research trying to develop tomorrow's medicine. And I want to just tell you a little bit about one of the innovative projects that we've been involved in at the Children's Hospital in the research area. But first I want to just give you a little bit of background. We live in incredibly exciting times. We're in a phase now in medicine and the biomedical sciences where genetics and cellular biology are moving ahead at a tremendous pace and offering profound possibilities for human health. Explosions in knowledge, improvements in diagnosis, more and better treatments. But these can only be realised through research. Now, one of the ways or areas that we can push research ahead or therapy ahead is what we call gene therapy, and this is an area that I'm personally very interested in. So just quickly, this is the use of genes as medicine, and if you think from a paediatric perspective, 1 in every 30 babies born is born with a major health problem. Many have genetic diseases, and there's real possibilities that we'll be able to treat some of these genetic diseases using exciting new genetic strategies. But it's not only about the possibility of treating genetic disease. This type of technology has possibilities for treating cancer. And this is quite a sad and poignant picture here. The fellow sitting up the back is a friend and colleague of mine, Jeff McGowage, who's a paediatric oncologist. And in the front is a little boy called River and his mother. Now, River passed away a couple of years ago with a brain tumour. And you can see that he's lost his hair, the consequence of the chemotherapy. And it really is a reflection of the fact that many of the therapies we have today are simply inadequate, and we need to do much more to find new therapies. Now, one of the challenges we have in treating conditions like brain tumours using chemotherapy is that the therapy is highly toxic, and that's why little River's got no hair here. But these chemotherapies also attack the gut, and in particular the bone marrow. And sometimes as you escalate the dose of chemotherapy trying to kill the tumour, you may actually kill the child's bone marrow first, and that becomes what we call a rate-limiting toxicity. So we've been developing some innovative strategies to try and help children with brain tumours by rendering their bone marrow resistant to chemotherapy using genetic strategies. So this is a very complex program. It's taken us many years to reach the point we're at now, but basically it involves taking bone marrow cells out of these children, taking them to a special facility, genetically repairing them using some very complex technology, and then taking those cells back and returning those bone marrow cells to the child, such that now when they get ongoing chemotherapy, those cells will repopulate their bone marrow and render their bone marrow resistant to chemotherapy, allowing us to use higher and better doses of chemotherapy to increase the chance of curing the condition. Now, to do this, we need the right sort of people, so it's been a long, hard road for us, training people up, developing the infrastructure on the campus, developing the reagents that we need to do this kind of work. Shown here is somebody working at a Class 2 biohazard hood, with a special facility we have at the Children's Hospital that is essentially an operating room for cells, where we can take cells and keep them absolutely pristine clean while we do the genetic modification. Here's a shot of some of the work we had to do to make the gene transfer formulation that would modify the cells. And I'm very pleased to say that after 8 long years, support from the state government, federal government, national NHMRC, National Health and Medical Research Council, generous people like yourself through philanthropy, we've been able to run this program to the point where we've now enrolled our first child. So here we've got pictured a little guy called Andy, who about a month ago, and he's got a brain tumour, about a month ago he was the first patient enrolled in our program. We harvested his bone marrow cells, we took them to our special facilities, used our highly skilled staff, genetically modified his cells, and have successfully returned the cells to him. And this is an ongoing clinical trial. So this was the team the day those cells were infused into Andy. Now, we don't know how this is going to go, but this is trying to push back the boundaries and the barriers and improve the quality of clinical care for very difficult conditions. And we now have a second child presenting that will undergo therapy in about a month's time. So this is an example of the innovative things that happen in the Kids Hospital, in the Sydney Children's Hospital network, that really simply can't happen elsewhere. So I'm very proud to be part of a system like that, and I'll leave it there.